Hi, question for UK anaesthetists. Did you know that if a hysteroscopy is done in theatre, the rebate is not enough to cover the costs? This is because they don't want them done in theatre under any circumstances, even if it is obviously the best course of treatment for the patient. This is due to the best practice tariff, makes the hospital approximately £350 for an outpatient procedure for half an hour and a £50 loss in theatre. They also give a bonus if 70%, I believe it's 70%, not sure if it's gone up to 75% yet, are done in outpatient. The problem with this is that they'll say, well, most women tolerate it. Well, they're diddling the figures rather. You'll find that 25%, at least 25%, don't tolerate it well and have severe to excruciating pain. And they also primarily focus on diagnostic, which is typically the lower end of the spectrum. If your hospital is doing operative, MyoSure, NovoSure, or TrueClear, and definitely ablations, the women in your hospital will be experiencing excruciating pain. Some have post-traumatic syndrome for this, and they also say, well, it's much safer in outpatient. Well, no, not really. For diagnostic, operative, that's another matter. However, is it much safer? Yes, there's a safety aspect of not having an anaesthetic. However, they find that women are having perforated wounds and they're just simply being sent out because there is no recovery room. So I have actually phoned the RCOA and asked about this, and they said, well, it's ultimately not our remit, it's not our position to say this. However, you should be able, the hospital should be able to make a small profit on an in-theatre procedure. I don't believe it's acceptable not to be paid enough for an in-theatre, especially if they failed, because there's a saying, trial by outpatient, that some hospitals don't offer, like Leeds don't offer a GA from the outset. Some do if you don't wish to be awake, and some give informed consent that this procedure may be excruciatingly painful or severely painful. You can have a GA from the outset if you wish. It varies hugely by trust. Some offer it from the outset, but one hospital like Guy's in St Thomas say you can have a GA or we can do it now, but the GA will be 3 to 6 months time. So ultimately, hospitals need to make money off procedures. If you're not being paid enough for them, someone needs to speak out and say something. Thanks, bye.